My name's Dr. Suzanne England. I've been a doctor for 17 years, including 6 years as a GP partner within the NHS. We've seen a huge increase in the rise of remote medicine and telemedicine, prompted certainly by the COVID-19 pandemic. As is often the case, necessity drove innovation, and we found as clinicians we were becoming increasingly comfortable with the use of remote working. We've realised that we can take a history remotely, and patients are gaining confidence as well. An example might be patient confidence in taking their own blood pressure readings and sending them to us in surgery. Through COVID-19 and the increased use of remote working, I think we've understood better the advantages of telemedicine in terms of reducing wasted clinician time, patient convenience, improved access. It has the potential to speed up access to the right speciality and reduces concerns such as infection control, no more waiting rooms or busy lines. Up until now, I think concerns about the limitations of telemedicine have related to reliability and data security. Like anyone else, if I was going to send my personal medical information, I'd need to know that it was a system that was trustworthy and secure. A system like Qlupod, which measures 6 vital functions, has the potential to improve patient outcomes by looking at a patient's blood pressure, their heart rhythm, their oxygen saturations, their blood glucose and their temperature. We're able to make sensible, timely decisions about their care. Having patients measure their blood pressure at home is really considered to be the gold standard. We're hoping to avoid the white coat hypertension effect, whereby a patient's readings are inaccurate just because they're at their doctor's. We use trends of blood pressure in order to determine when to start medication and to monitor and adjust those medications. Having patients measure their blood oxygen levels at home can be incredibly useful. Often it is a step we use to determine whether a person needs emergency care, such as admission to hospital, but also to monitor chronic diseases such as COPD or perhaps asthma. We can look at trends, we can look at responses to medication, and I think it's generally regarded to be the 6th vital sign. Having patients measure their heart rate and rhythm using a device such as Qlupod has the potential to be a lifesaver. We are very aware that heart arrhythmias are a significant risk factor for developing perhaps stroke or heart attacks, and detecting those as early as possible is the best way we have of avoiding life-changing events for patients. As a GP, I recognise that data security and confidentiality are utterly crucial. We're contractually obliged to ensure that any systems we use are trustworthy, robust and GDPR compliant. I think there's the potential for a product like Qlupod, which has 6 vitals combined in one device, for real ease of use for patients in terms of getting the data that we need as their clinician and transmitting it securely to us with a minimal risk of errors. The advantage of having a system such as Qlupod that captures data digitally and then sends it automatically is avoiding the potential for errors. What can often be the case if patients are transcribing information from a number of devices and sending themselves is the risk of errors. This is exacerbated if people are elderly, frail, perhaps struggling with their sight or hearing. A platform like Qlupod, which has 6-in-1 vital functions and an app to go alongside, can be very useful for patients who wish to take ownership of their own health. Over the next 5 years, we're likely to see significant challenges for the health service. One of the greatest is patient demand, which is only increasing. Access to services can be challenging. I think we all recognise that the role that telemedicine and remote medicine has to play in order to meet these challenges. Telemedicine has the potential to reduce wasted clinician time, to get people seen more readily and to get them to the specialties they need in a timely fashion. As a clinician, it's very significant that we have a record of patients' previous vital recordings. Looking for trends is often the key point to determining the relevance of any reading. I think there's the real possibility that remote medicine and telemedicine has opportunities for serving populations such as patients in rural areas where traditionally access to specialty services have been lacking. One of the challenges we have in managing patients is helping them to comply with their treatment regimes. This is often inadvertent when they miss tablets. I think there's real scope for a digital solution to prompting patients to take their medications, and this should improve patient outcomes. I think a lot of patients are recognising that the ability to monitor their own vitals and to transmit that information through to their clinician has potential health benefits for them. I certainly see a future where patients are able to monitor their vital functions, hopefully transmit them and share them with their clinician of choice, and then have the ability to act on those results in a timely fashion.